If you're living with rheumatoid arthritis and start noticing new symptoms, like a strange rash, unexplained numbness in your feet, or a deep fatigue that's different than your usual flares, it might not be your RA just acting up. In rare cases, it could be something called vasculitis, an inflammation of your blood vessels that can quietly cause a lot of damage if it's missed. I'm Dr. Bhanusali, a rheumatologist, and today I want to talk about how vasculitis can sometimes be hidden in rheumatoid arthritis, and what are the signs to look for. Let me tell you about Linda, one of my patients, who I've been seeing for many years, and she actually has very well controlled rheumatoid arthritis. She's taking a medication which you may have heard called Humira. It's a biologic, and overall her joints were fabulous. And they had been for a long time, which was why it was so strange when she told me that she's just feeling very different, not like her usual self. She was tired, but not just I want to go to sleep for a couple extra hours kind of tired. She was more like bone deep fatigue, and this exhaustion just wouldn't go away. Then came the rash, purplish spots on her legs. They weren't itchy and they weren't painful. They were just strange and they were spreading. And a few weeks later, she noticed a tingling in her feet. And then her right foot, she couldn't really pick it up very well. It was dropping. That was scary, and we ran more tests and found out that she had vasculitis. Her immune system had started attacking her blood vessels. We had to stop the Humira, even though her joints were feeling great on it, and we started a different biologic agent called rituximab, which is IV infusions that you take about every 4 to 6 months. And it targets the immune system in a different way. She has done very well on it. But her case was a little bit unusual because she has very well controlled rheumatoid arthritis. Usually when we think of vasculitis, we worry more about it in people who have uncontrolled rheumatoid arthritis, but that wasn't her. But anything can happen with these immune diseases. You just have to look for signs. A few years ago, celebrity Ashton Kutcher had a rare type of autoimmune vasculitis. It affected his hearing, his balance, his vision. It threw his equilibrium off. And he described it as a weird, super rare form of vasculitis. And unfortunately, this can happen. All it means is that those blood vessels are inflamed and we need to find ways to kind of calm that down. Fortunately, he has recovered, and early treatment can really help kind of prevent the organ damage that can happen if you leave it untreated. Now, vasculitis isn't just one condition. It's more of like an umbrella term that you use for a group of diseases that cause inflammation in the blood vessels. Some types, like giant cell arteritis, they affect the large blood vessels, and we think of new onset headaches in an older population and they're just not going away. Usually there's some inflammation associated with them. Or others like granulomatosis with polyangiitis, also known as GPA, or even EGPA, and other ones called microscopic polyangiitis, Takayasu's. And the name we give it often depends on the size of the blood vessel, whether it targets small vessels, medium-sized blood vessels, or even larger blood vessels. So the size of the blood vessels kind of tells us which condition it is and how to treat it and what to expect. Each form has its own triggers, but in conditions like rheumatoid arthritis, the immune system is misfiring and targeting the vessels instead. Who do we worry about? When someone has rheumatoid arthritis, we definitely worry more about a specific type of population. Someone who has very long-standing or aggressive disease. Somebody who's had it for a decade or two, and it has always been so aggressive and difficult to treat. Then vasculitis is more possible. But there are other risk factors as well. If you have high levels of antibodies, like that rheumatoid factor or the CCP antibody, if those guys are high, then you have a higher chance of vasculitis. If you have rheumatoid nodules, oftentimes people get them over here, although I've had patients have it all over the place, kind of in their hands, even other places in the body, that also increases your risk of vasculitis. Or if you're smoking or have other autoimmune conditions that are kind of overlapping, that also can increase your risk for vasculitis. So what are the signs to look for? The skin. If you have purplish or reddish spots that are forming on the legs, this is called palpable purpura. Or if you have painful sores or ulcers that are not healing, or even livido reticularis, it's this lacy type of rash. Some of my patients are like, this is just me. I always have this. But if that's the case, fine. If it's something new especially, or something that's worsened, this lacy rash, you definitely want to bring it to your doctor's attention. It's a mottled, net-like skin appearance. In terms of your nerves, if you're having more numbness or tingling in the hands or feet, yes, neuropathy is common, but this is kind of more out of the proportion or very new onset. Especially if you have sudden weakness with a foot drop, like Linda had. You can even get a wrist drop. Or if you're having more general symptoms, fatigue that's feeling very different from your RA-related fatigue, fevers, night sweats, unexplained weight loss can all be part of this picture. What about the eyes? You could have blurry vision or redness, which could be indicating inflammation of the eye. These aren't necessarily things to panic about, unless you have a foot drop or something very extreme. But it is something that you should bring up to your doctor, especially if they're new symptoms or they don't fit your usual RA pattern. So if you have these symptoms and you talk to your rheumatologist, the kind of tests that they order are, for example, blood markers of inflammation, the CRP or the ESR, but also something called ANCA, ANCA, which are tests for vasculitis. We also like to get imaging and biopsies because tissue can be very important in this condition. And as I said, there's different types of vasculitis, so you really want to know what you're dealing with. And if vasculitis is confirmed, we likely will need to adjust the rheumatoid arthritis medications. Sometimes we'll have to stop that TNF drug if that's what caused it, and start a different immune type of treatment like rituximab, and there are others nowadays as well, although that one has been the most studied so far. And in the short term, use what we love to use as rheumatologists, which are steroids. But of course, we like to use as little as possible, as little as we can get away with. But they do stop that reaction much quicker than if we don't use them. And the goal is to catch it early before it spreads. But Linda's story is a reminder. If you feel something is off, trust your instincts. The earlier we identify these patterns, the better the outcomes. If you've experienced any of these signs or even just learned something new today, drop a comment and let me know. And don't forget to like and share with somebody else who has an autoimmune condition that they want to learn more about. I'm Dr. Bhanusali with Plant Forward MD. Thanks for watching, and I'll see you next time for more health tips.